Dispatched to a county road for a bicycle accident. One
Okay.
patient.
I'm gonna assess scene safety, so we're on a road. Maybe I'll wear some PPE that's
Okay.
to make sure I'm visible on the scene. Mechanism of injury. We have one patient that we know of. Consider additional resources, maybe ALS if he's in a lot of pain. PPE gloves at a minimum, and then consider C-spine. So that was en route to the patient. So as I get on scene, I'm going to get my general impression. So I have a early 20-year-old white male who seems to be
He's in moderate distress.
moderate distress. Environmental cues.
You have
see
a
anything?
banged up bicycle and his helmet is off to the side.
His helmet's off to the side. So I'm gonna want to have my partner come and stabilize his cervical spine, take over and manage C-spine. So general impression is done. I'm gonna approach my patient now. Hi, sir. My name is Erin with MATC Ambulance. Could you tell me your name?
Joe,
Hi, Joe. Could you tell me what happened?
I fell off my bike trying to swerve from hitting a deer.
Oh, okay. Could you tell me what day of the week it is?
Tuesday,
Tuesday. And could you tell me approximately what time it is?
3 o'clock in the afternoon.
3 o'clock in the afternoon. Okay, patient is ANO times 4, GCS is 15. And then, so could you tell me what's hurting, what the problem is?
My
today?
left leg is hurting a lot. My left wrist is hurting.
Left wrist, left leg. Okay, so the patient's airway is patent because they're talking to me. I'm going to assess breathing, so I'm going to get pulse ox on.
Okay, pulse ox is 90% on room air.
90% room air, so I'm going to have a partner go and set up the oxygen tank and get him on some high flow oxygen. I'm going to listen to breath sounds.
Clear on both sides.
Clear on both sides. Okay, and is he breathing, like his breathing quality?
He's complaining of a little shortness of breath, but he has good chest rise and fall.
Okay, so we have him on the high flow oxygen, so we assess and intervene necessary with breathing. So circulation, I'm going to check for a pulse.
Pulses are present.
And then the condition of the skin.
Warm, pink, and dry.
Warm, pink, and dry. Do I see any obvious life-threatening bleeds?
No obvious bleeds.
Okay, differential, we have a trauma from crashing his bicycle. So I'm going to expose the whole body and then do a fast rapid scan. So I'm just going to start with the head, kind of looking for any deformities or pain.
No deformities.
Check the face. Quick look for any fluids.
No
My
fluids.
partner has C-spine, so I'm just going to work around that. Check the neck, front and back.
Okay.
Any tracheal deviation.
Tracheus midline.
Any jugular vein distension.
No JVD.
Check the sternum.
Intact.
Check the clavicles.
Stable.
Could you breathe in deep for me?
I can.
All right. Listen to another set of lung sounds.
Clear on both sides.
Okay, I'm going to palpate the abdomen once.
Soft and non-tender.
All right, I'm going to check the integrity of the pelvis.
Stable.
All right, and you said it was your left leg.
Left leg.
That hurts, so I'm going to start here with the right. Any pain?
No pain.
In your right leg, and then the left leg. Can
I
you
have
tell
a
me where?
painful swollen deformity in the left upper leg.
Left upper leg. Okay, so I'm going to have a partner of mine come and immobilize and manage that injury. Any other pain in the lower part of
No
the
pain.
leg? Could you push up on my hands for
I
me?
cannot on the left, I can on the right.
Could you push down?
I cannot on the left and I can on the right.
Can you feel me touching your foot?
Yes.
What about this one?
Yes.
And then I'll check for pulses.
Pulses are present.
All right, and then you said your left wrist?
Left wrist, yes.
Left was hurting? Okay, so I'm going to check your right arm. Any injuries? Any
Nothing
pain?
on the right.
Okay, check the upper left arm.
You have a really painful left wrist.
Painful left wrist. Okay. Can you squeeze?
I cannot squeeze the left, but I can on the right.
Okay. Can you feel me touching your hand?
Yes.
What about the other hand?
Yes.
And then pulses?
Present.
Okay, so I'm going to have another partner of mine manage the wrist, splint that as necessary. So fast rapid scan's done. So I'm going to say this is a high priority patient, so we're going to load the patient up and prepare for transport. All right, sir, so you have pain in your left wrist and left leg. Is there any other kind of signs, symptoms you're experiencing?
No other signs or symptoms.
Okay. Do you have any allergies?
No allergies.
Are you taking any medications?
No medications.
Is there any pertinent medical history you're seeing a doctor for?
None.
Okay, and when was the last time you ate?
I had breakfast this morning.
Okay, and just to double check, you were riding your bike and there was a deer that came into your path and you swerved? Is
That's
that
exactly what happened.
Okay, anything you want to add before and after about that event?
No.
It's important. Okay, so I'm gonna go and get some vital signs on you. I'm gonna get a blood glucose,
Normal.
pulse ox. Now the oxygen is up.
98% with oxygen
All right, the pulse,
is 100.
skin condition,
Warm, pink, and dry
blood pressure.
is 120/80.
Okay, pupils,
Pearl,
capnography,
35 and regular
respiratory rate,
is 12.
and then we'll get a 4 lead on you just.
Sinus rhythm.
Okay. So secondary assessment. I think that was all the vital signs. I'm just going to go through a more thorough kind of exam. So I'm going to start at your head again. If anything hurts or feels tender, please let me know.
My neck is a little sore now.
Neck is a little sore. Okay. Could you open your mouth for me?
I can.
Do I see any teeth, blood, or secretions?
Nothing noted.
Okay. I'm going to just check your ears, nose, mouth for any blood. You said your neck was feeling tender.
Yep.
Any deformities?
No
or
deformities.
Abrasions or anything. So my partner still has C-spine, and we're in the hospital en route, so we're mobilized. Checking the collarbone,
Stable.
the sternum.
Stable.
Listen to breath sounds.
Clear on all sides.
All right, I'm gonna palpate the abdomen in all 4 quadrants.
Okay. Soft and non-tender.
Check the integrity of the pelvis.
Stable.
All right. Check the back.
Nothing noted on the back.
Check the right leg.
Right leg is fine.
The left leg.
Painful, swollen deformity in the left upper.
And nothing down lower.
Nothing down low.
Could you press up on my hands for me?
I cannot on the left, but I can on the right.
Press down.
I cannot on the left, and I can't not on the left, and I can on the right.
Can you feel me touching your foot here?
Yes.
What about this foot?
Yes.
And then check for pulses.
Pulses are present.
Okay. Check the right arm.
Nothing noted.
Check the left arm. Being very careful. Anything, any bruises, anything new to that
Just
wrist?
swelling of the left wrist.
Okay. I'm gonna ask, can you squeeze my fingers for
I cannot
me?
squeeze the left.
Can you feel me touching this hand?
Yes.
What about this hand?
Yes.
All right. I'm gonna just check for pulses.
Pulses are present.
Okay, so the detailed scan is done. So management, we have splits on the left wrist and the left and the femur. We have oxygen on. I'm gonna go and maintain his body temperature as necessary. I think that's all the pertinent management. And then I still think we need to get to the hospital, so we're still on the way transporting. And then I'm just gonna reassess now. So I'm gonna start with his level of consciousness, go through the primary assessment, see if there's any other information that he can give us for like a history taking, reassess our secondary assessments, so our management, our transport decision, everything like that. And we're just gonna keep reassessing every 5 or so minutes until we get to the hospital. Oh, and reassess vitals. Dang it!